let's talk about this commonly tested GI topic on NCLEX, peptic ulcer disease. Now, before we dive in, let's refresh our anatomy because this is going to help you understand rather than memorize. So if you look at my pre-drawn stomach up here, when we eat, our food goes down our esophagus and lands first in our stomach. From our stomach, it's going to move into the small intestines. The first portion of the small intestines is called the duodenum. So we have two types of peptic ulcer disease. We have our gastric ulcer and our duodenal ulcer. Now let's see how we can differentiate between the two. So first off, it's just important to remember what causes a peptic ulcer, whether it be gastric or duodenal. Common causes that you might see on NCLEX are chronic NSAID use, so this is Advil, ibuprofen, an H. pylori infection, or recurring stress. Now let's talk about patient presentation and how you can differentiate the two. So for starting off with gastric, remember when we eat something, it goes down our esophagus and dumps right into our stomach. So these patients are going to complain of pain 30 to 60 minutes after eating. Once that food starts moving out of the stomach, it goes into our duodenum. So people with duodenal ulcers are going to have pain an hour and a half to 3 hours after eating. Now let's go back to gastric. So when are we going to have pain? 30 to 60 minutes after eating food. Pain is going to be worse during the day, and it's going to be worse with food like we talked about. For duodenal, we're going to have pain worse at night, and here's a key word here. Pain is going to be better with food, right? Because when we eat, the food goes right into the stomach, so it's secreting acid in the stomach area, not as much acid in the duodenal area. Now let's look down here and talk about the common medications you'll see in peptic ulcer disease, okay? Sucralfate is going to be the first one. So sucralfate basically is a protective film or layer that sits on top of the ulcer, so it covers it. You want to encourage your patient to take it 1 hour before eating and at bedtime to protect them overnight. Next, we have our H2 blockers. So these commonly end in the suffix dine. This is ranitidine or famotidine. They're going to decrease the amount of acid being produced, okay? Now, it's important to remember when it comes to suffixes, not all medications follow these rules, okay? So you are going to see other medications that might end in ine. Don't immediately jump and think that they're an H2 blocker. Suffixes are just a common way that people help group medications and help them remember. Now let's talk about our PPIs. So they typically all end in prazole. This is pretty straightforward across the board. If you see a medication like pantoprazole or omeprazole, you are going to think that it's a PPI. And these suppress the amount of acid that are going to be excreted from the stomach, so it decreases symptoms. All right, so that's it for peptic ulcer disease. If you found this helpful, please share with your nursing friends or anybody starting to take the NCLEX.